Hello everyone, I am Dr. Deepa. Today we learn about the deltoid muscle. As we all very well know, the deltoid is the muscle of the scapular region. It is the main muscle which is responsible for the round counter of the shoulder. We study the deltoid under the attachments, nerve supply, actions, the structures beneath the deltoid muscle and the clinical importance of the deltoid. Now this deltoid covers the entire shoulder region and is responsible for the round counter of the shoulder girdle. Moving on to the attachments of the deltoid muscle. Yes, the deltoid muscle has its origin and the insertion. The origin of the deltoid muscle is divided into three sets of fibers, that is the anterior fibers, the posterior fibers and the middle fibers. The origin of the three sets of fibers are the anterior fibers of the deltoid take origin from the clavicle, that is the anterior border of the lateral one-third of the clavicle. Yes, the anterior border and the upper surface of the lateral one-third of the clavicle give origin to the fibers, that is the anterior fibers of the deltoid muscle. Here we can make out the origin of the posterior fibers. Yes, the posterior fibers take its origin from the lower lip of the crest of the spine of the scapula. And the middle fibers take its origin from the lateral border of the acromion process. This is about the origin of the muscle. All these three muscle fibers descend down to reach the humerus and get inserted onto the deltoid tuberosity, which is located in the lateral surface of the middle part of the humerus, giving a typical appearance of the V-like fashion. So this strong muscle has its origin from three sets of fibers and get inserted into this deltoid tuberosity. Now here we can make out the origin of the muscle: anterior fibers from the clavicle, posterior fibers from the spine of scapula, and the middle fibers is from the acromion process. So anterior fibers take its origin from the lateral one-third of the clavicle, that is the anterior border of lateral one-third. The lower lip of the crest or spine give origin to the posterior fibers, whereas the acromial fibers or the middle fibers take its origin from the lateral border of the acromion process, and all these fibers are seen merging to get inserted into the deltoid tuberosity. Now this is the picture where you can make out the posterior view of the deltoid covering the entire shoulder region. Now what we see here is the crest of the spine, and these are the posterior fibers arising from this spinous process. This is the anterior view of the deltoid muscle, where we can make out the anterior fibers arising from the clavicle, that is the lateral one-third of the clavicle. Now, regarding the structures which are under the cover of the deltoid, as this deltoid muscle covers the entire shoulder girdle, there are many structures which are hidden beneath the deltoid. There are bones, muscles, joints and the ligaments. Now bones which lie under the cover of the deltoid is the coracoid process of the scapula, the glenoid cavity, the entire upper end of the humerus. The muscles are nothing but all the muscles which take its attachments from the coracoid process, the tubercles, that is the greater tubercle, the lesser tubercle, and the deltoid groove or the intertubercular sulcus of the humerus. The muscles are the muscles which come under the cover of deltoid are the muscles which are attached to the coracoid process, that is pectoralis minor muscle, the tip of the coracoid process which is giving attachment to the coracobrachialis, and the short head of biceps. Yes, these are the muscles of the coracoid process. So, pectoralis minor, the coracobrachialis, short head of the bicep, the muscles which are attached to the supraglenoid tubercle. Yes, supraglenoid tubercle, that is the long head of the biceps. Yes, the long head of the bicep, the infraglenoid tubercle which gives attachment to the long head of the triceps, which is the muscle of the back of the arm. Yes, the long head of bicep, the long head of tricep. Other than these muscles, the muscles which are attached to the upper end of the humerus, that is muscle attached to the lesser tubercle, that is the subscapularis. Yes, the muscle subscapularis, the muscles which are attached to the greater tubercle. What are the muscles attached to the greater tubercle? That is supraspinatus, infraspinatus, and the teres minor muscle. Yes, the supraspinatus, infraspinatus, teres minor muscle, and the muscles attached to the bicipital groove or the intertubercular sulcus, that is the pectoralis major, teres major, and the latissimus dorsi in between. So all these muscles come to lie under the cover of the deltoid muscle. So I repeat the muscles which are under the cover of the deltoid. The muscles relay or attached to the coracoid process, that is pectoralis minor, the coracobrachialis and short head of biceps, the muscles which are attached to the supraglenoid tubercle, that is the long head of bicep, the muscle attached to the infraglenoid tubercle, that is long head of tricep, the muscle attached to the lesser tubercle, that is subscapularis, muscle attached to the greater tubercle is SIT, that is supraspinatus, infraspinatus, and teres minor, and left over is the muscle over the intertubercular sulcus, that is a lady in between the two majors, as we remember in this fashion, that is latissimus dorsi in between pectoralis major and the teres major along the borders of the sulcus. So all these are the muscles which are coming beneath the deltoid muscle. Moving on to the joints and the ligament, as we know that the important joint, that is the shoulder joint, and the ligament related to the shoulder joint, mainly the coracoacromial ligament, comes under the cover of the deltoid. The nerves and vessels which are under the cover of the deltoid are related to the surgical neck of the humerus, that is the anterior and the posterior circumflex humeral vessels along with the axillary nerve. So these is about the muscles under the cover of the deltoid. So in this picture we can make out the important bursa which is seen beneath the deltoid, which is called as subdeltoid bursa. The extension of the subdeltoid bursa beneath the coracoacromial arch is itself called as subacromial bursa. So this bursa is also hidden deep to the deltoid muscle. So this is the coracoacromial arch, the subacromial or the subdeltoid bursa. All these, yes, here is the intertubercular sulcus, the biceps tendon, the long head. All these make up the structures lying beneath the deltoid muscle. So this picture shows only the ligaments related to the deltoid area, that is beneath the deltoid. We can make out the coracoacromial ligament over here and all the ligaments and capsule related to the shoulder joint. Regarding the nerve supply of the deltoid muscle, yes, the deltoid muscle is supplied by the axillary nerve. The root values are C5 and C6. This axillary nerve is nothing but the branch coming out from the posterior cord of the brachial plexus. Yes, so the nerve supply of the deltoid muscle is by the axillary nerve. The axillary nerve not only supplies the deltoid muscle, it is also seen giving muscular branch to the teres minor muscle as well. Moving on to the actions of this deltoid muscle, yes, each muscle gives certain set of action, that is the muscle fibers of the anterior, posterior and the middle. The anterior fibers, yes, the anterior fibers take part in the adduction, flexion and the medial rotation of the shoulder, whereas the posterior fibers take part in the lateral rotation and the extension of the shoulder. The middle fibers participate in the abduction of the shoulder. So this is about the action of the muscle. Lastly, the clinical importance of the deltoid muscle. Yes, this deltoid muscle, as it is very strong and extensively located around the shoulder, is the site for the intermuscular injections. Yes, the intermuscular injection is usually given over the deltoid muscle. The lower part is usually avoided to prevent the injury to the axillary nerve. So this is about the deltoid muscle for today. So we have studied deltoid under the attachments, the nerve supply actions and lot many structures which are hidden beneath the deltoid. So we'll look for the muscles of the scapular region other than the deltoid in our next video. Thank you.